Hey everybody, welcome to Signals in Higher Education. This is Darin Francis with Harbinger Lane. With me today, I've got Jason Aubrey, the founder and CEO of Skilltrade. Jason, welcome to the show.
Thanks for having me, Darin.
Well, look, before we get into Skilltrade, I want to you're a repeat founder in this space, and workforce development and ed tech is sort of the intersection you've lived at. You scaled MedCerts to an acquisition by Stride, and now building Skilltrade. So I know that you've got a really specific point of view here. But before we get into Skilltrade, talk a little bit about what you learned about the industry and about what was needed when you were at MedCerts even that led you to thinking about something like Skilltrade.
While at MedCerts, right, we ultimately were solving similar pain points, right? There are critical staffing shortages in healthcare. There's a rising trend in student loan debt in higher education. And ultimately, we felt that higher education in some capacity was a little bit outdated, wasn't necessarily moving along with the trends in terms of, creating flexibility for students through highly immersive curriculum, right? Delivering it online, right? Not every individual is immediately after high school, college bound, where they can go spend 4 years and live on a campus, right? There's a large population, right, that have a lot of life challenges. And so at MedCerts and with other training organizations, right, creating short-term credential-based programs in a very short period of time that lead to employment, that actually have career ladders, it makes a big difference, right? And it's a great stepping stone for someone to come from one industry and go into another, or someone who, might be unemployed at that given time to step into a new career, specifically in healthcare. And so that's ultimately kind of the similarities. We saw a lot of that. We think that the short-term skills-based training could solve critical staffing shortages pretty quickly. And we did that by partnering with a number of organizations, which, I'm excited to talk with you about. And clearly at Skilltrade, there are some differentiations as well.
Yeah. I mean, hey, everything I know about allied health, I kind of learned from you, and I'm leaning on you for this conversation. But I feel like when you talk about the shortages in this space, this is a persistent problem. What has been your experience? What's at the heart of it? And what are you doing to try and really stem it, other than just training more people for the roles?
Well, I think at a high level, accessibility, transportation, and awareness, right? So what do I mean by accessibility? There's more critical staffing shortages in my mind from what I've seen in rural areas, meaning that there aren't community colleges nearby a hospital system that might be in a rural area. Or if there are, they might be 40 or 50 miles away. If they do exist, right, most schools today offer these programs as associate's degree programs. And that could take 18 to 24 months. That could cost tens of thousands of dollars. And not everyone, again, like I talked earlier, has that flexibility. It doesn't really align with their schedule. They might have transportation barriers. And they're more and more, students are questioning the ROI on education. Right. So frankly, it doesn't really make sense to spend $40,000 in 2 years to land a job. Right. It's an entry level job that can pay you upwards of $45,000, potentially up to $80,000. Right. Again, what we're trying to do is build a career ladder. Right. I always like to say we don't just train medical assistants or sterile processing or surge techs. We're ultimately trying to train future nurses. Right. By articulating college transfer credits into our programs with other higher education partners. We'll talk about that in a little bit, right? So we talked about accessibility, we talked about flexibility, and the education ROI on the investments. The other thing is awareness. I just read in the Wall Street Journal not too long ago, roughly 3 to 6 months ago, they had a full feature on a very specific program and occupation, and that's a sterile processing technician. Right, they're saying it's like almost like a hidden gem that people in this country don't number one know what a sterile processing tech is. They don't know that what the wages and the salaries are. Right, they don't know that there's a critical staffing shortage, and they certainly don't know that there are programs where within 14 weeks you could actually land a job as a sterile processing tech. What they also don't know is that employers might be willing to sponsor you. or that a workforce agency or a nonprofit through federal, state, or local grants and funding opportunities in the workforce development realm has funds available, and there are training partners and employers who work together to try and find candidates and recruit them. That's what I mean by awareness. And so oftentimes schools might say, well, we can't fill the seats for this program. Or an employer might say, I can't find candidates. Well, then I ask, do you advertise? Right? How do you actually build awareness? Because what we find is when we build awareness within a very short period of time, like I'm talking within 72 hours, you will have hundreds of job applicants who raising their hand say, I'm highly interested in this program because of the flexibility, the cost, the duration, and sometimes it's free. There is no cost for a student. I mean, what better way to enter a job market than to do so without any debt?
Right. Well, and you're hinting at a piece that I think is going to be fun to unpack, which is really kind of more or less a three-sided marketplace. I want to get to that in a minute. I think before we do, I want to dive a little bit further into the problem and sort of your unique positioning, because it's not just that you're positioning yourself into this sort of multi-sided market and serving a lot of different interests. You've got a particular philosophy about how to train up these folks. And so, lots of other online training options out there that colleges could elect to be using, or they are, MedCerts being one of them. What makes what you've designed at Skilltrade so unique?
Number of things, right? Curriculum, how you develop it matters, right? So there are organizations, training companies, higher education that really have outdated curriculum. Like we're talking voiceover presentations, and ebooks and even physical books, right? This isn't very engaging. It's not very interactive. We build highly immersive curriculum, and we're kind of fortunate enough that, we're a newer organization, so we can leverage some of the new technologies that exist today. So we have everything from an instructor-led video to a virtual simulation that emulates a physical environment to AI-based conversations, where if you're in a program that we have, it's a medical assisting program, your students using their microphone and they're talking to an avatar patient. The patient is presenting different symptoms, always different, and you have to interact during patient intake. And the system's actually scoring. And it'll come down to things like, what were your compassion levels? Like, can we improve and help you with compassion? Did you ask about the family medical history? You forgot to do that. So I think that matters. I think the learning management system matters a lot in terms of course layout. Right? How do you structure the course? Is it simple? Is it easy to navigate? And do you have the analytics and the reporting readily available for your partners? Higher education wants to be able in real time to say, how are my students doing? This cohort, I want to know exactly where they're at. Same thing for employers. And I believe we're going to talk a little bit about, the pending Pell Grant eligibility for short-term credentialing. One of the key components of that is analytics. It's insights. You have to report outcomes. There are a lot of companies out there that are still putting all this data into a spreadsheet and sending it to a partner. I think that matters. The other differentiator is what I found in allied health is that online curriculum, it's great. I think it could do the job, but it only gets you to a certain place. And I firmly believe that to yield great candidates, to yield great outcomes, to make employers happy, you really need to incorporate hands-on training, right? So if you're training a medical assistant, right, they should be drawing blood before they actually draw blood as an employee on site. If you're a surgical technician and you're laying out the tray of the instruments and you're sterilizing the equipment before and after surgery, and you're handing a piece of equipment when the surgeon tells you he or she needs something specific, you should have actually sterilized equipment. You should have actually touched equipment before you start working full-time in a capacity, especially in an operating room. And so what we've done is combined online training with in-person training. We call it hybrid training. How do we do that? We pay doctors' offices to use their exam rooms, or we pay dental offices to use their sterilization equipment during off hours. So every other Saturday, a cohort of students will go on site. We will recruit and deploy an instructor. We can ship consumable supplies and manage that inventory. And that's where students are getting their hands on training. In some cases, we're working with hospital systems and health systems. We go on site at their locations to do so. And they have the option to either engage our services to facilitate all of that in-person training, or sometimes they're adopting our instructor lab guides and they're doing the teaching themselves. So it allows them in some capacity too to kind of activate and spin up, kind of their own mini academy in a sense, right? And we're going to talk about how they're doing that for upskilling or recruiting untrained talent to fill vacancies. But these are kind of some of the differentiators I think exist and what I've seen over the years, and ultimately why I built not just our programs, but our tech stack, and our ability to facilitate and deploy in a scalable way in-person training. I really do think that sets us apart.
Yeah, no, it really does. What we've been learning in this series we're doing on experiential learning in higher ed has been that across the board, regardless of what it is, when you give students that real work-based experience, their retention goes up, right? Their completion goes up, their grades go up, their overall satisfaction with the course goes up. And a lot of that comes down to the things you just said, but also just until I've actually done a little bit of this stuff, I don't really know that I want to, right? Like I might still have some anxiety about being in this, in the surgery center, right? Or whatever. So yeah, this is super, super helpful. So now you're working with higher ed institutions, workforce boards, and employers. Start to help me unpack the three-sided marketplace that you've gotten into.
Well, it's not as convoluted as it sounds. It is pretty dynamic, but at the end of the day, it's really simple if you know how to connect the dots. And I always, to describe it, I always like to just give real life examples. So let's take one of our academic partners, right? Texas Women's University, very reputable in the state of Texas, partners with a number of health systems throughout the state, largely, right, traditionally a degree granting institution. They launch TWU Ventures, right? So this is for short-term certification training. We're their partner in the allied health space, right? Specifically, medical assisting and sterile processing. They have advanced simulation centers in their campuses in Dallas and Houston and Denton. Earlier that in some capacity, we pay doctors to use their exam rooms when they're closed. Well, in an instance of an academic partner like this, our cohort of students will be learning on campus at TWU in their advanced simulation centers, right? They have all the equipment there. It's really a replica of what you'll see in a health system. It's pretty amazing. So on one hand, we could actually better utilize underutilized capacity and within campuses. That's one way we do it. The other thing is that because they have relationships with healthcare employers who have these pain points, we're able to come in as partners, approach them collectively and say, we have these models to help you solve your critical staffing shortages. And over time, actually develop future nurses. Well, so how do we do that? Go to the employer. We say, hey, well, we have a couple options, right? Number one, you can sign up to host students in externships, which are ultimately clinical rotations. So as we're training students, they're getting clinical rotation experience, which is for a hospital, free labor, and an opportunity for you to really get to know that person and then decide to hire them full-time when they complete their program. And other times, a hospital, they have thousands of employees in some instances, and they could be anywhere across the organization, right? They can be in janitorial services. They could be a receptionist. They could be in housekeeping, right? And you can identify those. They could be a sterile processing tech or a medical assistant. You can identify those internal candidates. I like to call them internal mobility candidates. You could say, hey, you know what? You're a sterile processing tech right now. You're already in the OR. What do you think about upskilling to become a surge tech, right? Because as part of a surge tech program, you actually need to observe 120 surgeries. So what a great way for a sterile processing tech to incrementally increase their wage in a very short period of time. The employer pays for it. It's totally tax deductible. And within 16 weeks, you've now solved your surge tech staffing shortage, which is directly tied to revenue. If your surgery center shuts down, you're not only not helping patients, but you're potentially losing millions of dollars if you even shut down for 3 days. So that's a great way of deploying the upskilling model, right? Then you might ask, well, if I take sterile processing techs and convert them into surge techs, well, you can upskill other people. You can upskill a medical assistant, a receptionist, patient care technician to become a sterile processing tech. So you're building this process to, it's not necessarily robbing Peter to pay Paul, but you're actually replacing a candidate pool who you're upskilling to solve other critical staffing shortages. But you mentioned a 3-way partnership. There are other ways that we work with in conjunction with higher education and employers, and that's through workforce agencies and nonprofits. There's immense amount of funding available at the federal and the state level and through philanthropy to train a workforce, largely, individuals with challenging backgrounds, transportation barriers, potentially daycare barriers, and they might be on unemployment or they might have getting government assistance. With those funds that are available, we could identify those individuals. We can pre-screen them and support them along the way. But also there's a number of funds available for incumbent worker training, which is another term for upskilling, and apprenticeship training, right? There's more and more funding going into apprenticeship training, which includes not only, learning through and going through a program, but getting 2,000 hours of on-the-job training. Shortly, we're actually anticipating approval from the Department of Labor for all of our programs to be registered apprenticeship training programs. This actually allows us to deploy in most all 50 states immediately from a compliance perspective and to leverage these types of funding sources. So for employers, I always like to say that we're pretty unique in that we're not just a training organization. We actually help bring funding to the table if there's not a budget for the employer to sponsor a student specifically.
I'm thinking about our higher ed audience, and I feel like good news that there's funding available. I'm sure they're aware of some of that, and you actually can help them unlock it, which is also a unique benefit of working with you. But I wonder how they see this, because there's the angle that I'm going to bring students who I wouldn't have otherwise gotten through a program through you. So good. I've engaged the community. I've added, somebody new to the roster, but they're just going through a Skilltrade program. But that also, you sort of hit on something already, which is if they're successful in that, then they can also become candidates for coming back and doing nursing or some other additional certification. What do you see as sort of the primary drivers and the things that excite the higher ed side of the equation the most? Is it one of those two items, more on the retention side and building or bringing in new prospective students, or is it more the idea that you could convert those Skilltrade students into larger, or what do you?
Yeah, what I would say is there's a number of perspectives. Everything you said is front and center. Right, on one hand, institutions are looking for ways to increase enrollment in their degree granting programs. One of the ways to do that is to launch certification training programs that articulate college transfer credit to a degree program. So if you train a medical assistant, they then start working, let's say at a hospital, they're getting on the job training. Their hospital may actually have a tuition reimbursement program and a partnership through an education as a benefit platform like Bright Horizons and EdAssist with said college or university. They then are going back. They might be taking night classes or an online nurse degree program and eventually, becoming a nurse. So it's potentially a lead generation. It's also academic colleges, community colleges, they're really there to support their local community and to work with employers. And these employers have these pain points. Now, that institution may or may not have existing programs. Let's just say they don't have existing programs. In that instance, it's a no-brainer, right? I'd love to launch a program, but we don't have the capital to make that investment. Can't build a curriculum, can't hire a professor, we can't buy the equipment. So they outsource it to a program management partner. They outsource it to companies like Skilltrade. And in that instance, it's non-competitive, and I think it makes a lot of sense. You can recruit students. You then become more relevant. You have increased capabilities to your local community, whether it's a local workforce agency and board, right, helping employ people, or it's with the employer, helping them fill critical staffing shortages, right? You're staying relevant in the market. There are some institutions, they may be right or they may be wrong, time will tell, that are hesitant to launch certification training programs because they might have an associate degree program in the similar field, even though those programs may only start once a year, right? That's not a lot of flexibility for an employer or for a student. They may take 18 months. It may cost tens of thousands of dollars. But they're worried that anything net new or net different that's less expensive, more affordable, and faster is cannibalization to revenue and tuition dollars. And what I like to say is, look, if you're really worried about that, this is a program that could supplement your associate's degree program, right? You can go to employers and they can upskill internal staff through a certification program. You can still keep your associate's degree program, or you can replace it, right? But at the end of the day, I think you're going to train more people. It's better for everyone. It's better for the student. They don't graduate with debt. They get a job faster. They start earning income faster. It's better for the employer because they're solving their critical staffing shortages faster. It's just kind of like any other industry, right? Like you have a product for so many years, but then disruption occurs. In those that, in my opinion, right, there's kind of a quote someone once said to me, and I remember it often. It's those that adapt will succeed.
Right. Yeah, no, that makes a lot of sense. And we're squarely in this space where you're building something where there are huge workforce shortages in allied health. And now we're starting to see a Workforce Pell initiative crop up. And so it feels to me like there are multiple things moving the pendulum in your direction. Talk a little bit about what you've learned about Workforce Pell and how institutions in particular ought to be thinking about it.
Sure. Well, first and foremost, Workforce Pell, it's been something that has been an active conversation for a very long period of time, in that, if and when financial aid would apply towards skills-based training, short-term certification training. We now know that it will, tentatively launching in the summer of 2026. Then the first question is, what are the requirements? What are the prerequisites? They are, small things as example, as follows, right? The programs, I believe, have to be between 12 and 15 weeks in duration. They have to be a minimum of 150 hours, but less than a certain amount of hours. They have to lead to, and there has to be evidence behind this, job growth, labor shortages, and reasonable wages. They have to have outcomes of 70% program completion, 70% certification, and 70% job placement. And as part of Workforce Pell, if you're going to use these funds for these programs as a higher education institution, it needs to be your program. You need to get it approved. You need to teach at least 50% of the instruction. I believe it's between 25 and 50% of the instruction. And you need to have the readily available outcomes data and analytics, right? And so to your point, like, yes, the fundings are kind of, the dynamics are moving in a direction that is favorable to training organizations if they're built the right way. That's why we've built a platform and a technology platform, which, can be licensed by an institution. It could be white labeled. We have customer portals for them to log in real time to look at the student outcomes. And we allowed them to pop into our learning management system and actually be the instructor, right? Like, we combine self-paced curriculum with weekly live lectures and weekly or biweekly in-person labs. But their instructors could actually access our systems and instruct that course and that curriculum. So as the owners of the program, as the owners of the instruction, we're essentially within the framework of the rules and the regulations, clearly, openly, and publicly doing so. And they're able to actually leverage a new funding source, which, again, it really only impacts, it impacts really everyone involved. It positively impacts the institution, positively impacts the job seeker, and it certainly positively impacts the employer who has some real pain points.
Yeah. So I want to put together like a hypothesis here of the types of higher ed institutions that would be most interested in this, right? Like, you kind of outlined it already. It makes sense to me that community colleges, due to their charter of working within the community with employers, that makes a ton of sense. But it feels to me like almost any higher ed institution, due to your transportation point, with close proximity to and potential relationships with hospitals and other healthcare employers, would be another component. Do you feel like there's a sweet spot here that you've identified, or are you seeing interest from all different institution types? What's been your experience?
We're seeing interest from all institution types, for-profit, public institutions, medical colleges, to community colleges. It really dependent on the type of partner. There are different roles and responsibilities between the two parties. So, as an example, medical colleges, I think, are it's quicker to activate and be successful because of their existing relationships with healthcare employers, right? Just makes things a lot easier, right? You get to open doors faster. Your partners and their pain points quicker, and often you're already, in partnership with the workforce agency and able to potentially obtain funding sources. You want to pick a partner who's going to dedicate business development efforts on your behalf. And we've built our organization out to do just that, right? Transparently, oftentimes we may want to go into a market, right, a specific state, but as a for-profit proprietary school, there's a long application process, a lot of regulations. It may take us 18 to 24 months to be able to service students in that region. But if we find a local community college, as an example, who wants to add net new programs to increase their revenue, to build lead generation for degree granting programs, to stay relevant in the local community and expand their employer partnerships, we can come in and conduct business development on their behalf. We'll call upon the workforce agencies, we'll call upon the employers, and we can even help recruit the students. And so, again, we can definitely service all types of organizations, but dependent on who they are, again, the roles and responsibilities may vary.
Which of these institutions, in your experience, these different types of institutions, are most interested in your training becoming a part of like a stackable credential or a credential back into an associate's degree or otherwise?
Those that have stackable degree programs, right? So if you're offering, if you have a nurse degree program, great, right? PAs, you name it, right? Any degree program in healthcare, there's a very, very clear academic pathway there's also a very clear, indirectly because of that, there's a very clear career growth trajectory, right? Healthcare is one of those fields that you can start here and you can end here. It's so obvious what that career ladder is. And along the way, you're just continually getting trained and just advancing your career as you're attaining additional credentials or attaining additional degrees.
It feels like the career ladder aspect is key to retention of these employees, right? Like, a lot of them come into it and say, I'm going to do medical assisting. And then at a certain point, we're like, oh my gosh, I got to get into something else. Then they go get an extra certification. Like having an awareness for that, I think is probably one of the bigger drivers for higher ed, because when you recognize that sometimes what you're doing is by giving them a shorter term hybrid experience through Skilltrade, you're trading off versus an associate's degree. If that's the wrong framing, the right framing here is you're getting a student you wouldn't have gotten otherwise, and you're helping them lift themselves up, potentially out of poverty, getting into a job, getting transportation, experiencing fullness of life. And then if they came through you, you're going to be where they go for the next certification and the next, until they decide to maybe become a nurse one day, right? So I like the overall framing, and I now understand why at Skilltrade you started with allied health. And maybe we should talk a little bit about where you're heading down the road once you've solved the healthcare crisis, what you're going to solve next. But while we're on this topic, you've mentioned before a goal of graduating 10,000 licensed healthcare professionals over the next 3 years. That's not just ambitious. It feels like because you've added a higher bar for yourself to deliver this through hybrid, that it would be hard for you to scale very many students at one time because of the hybrid nature. Like, so to help me understand, like, how this scales from your perspective.
Well, it starts with your partners, right? In your approach. We don't advertise. We don't enroll individual students every day of the week, right? Because I like to say, like, gone are the days of train and pray. We set up strategic partnerships that drive growth. So when we work with workforce agencies, they'll enroll cohorts of 15 or 20 students at a time, and they'll do so 5 times a year. We find a location to train those individuals in person. We recruit teachers. We ship consumable supplies. So yes, there are logistical priorities there, not real challenges. And in partnership with all these organizations, we're partnering with the employers. And oftentimes, we're working with nonprofits to provide wraparound services. So if there are transportation barriers, or if there's additional motivational coaching that you need, or potentially facilitation of daycare, right? It's great to work with partners that can actually offer these services to students along the way. But ultimately, when you build out that infrastructure and you yield great outcomes, you continually will scale. When you partner with higher education, same concept. They start helping you, we write grants together. We work with the workforce boards, we work with the health systems. And when you have the right partner and you build the right infrastructure, you yield the right outcomes, that just continues to grow and scale, right? We also have channel partners, right? We work with, organizations like CLASP or Tandem or Scholars Network, right? These are organizations that offer these employer-sponsored tuition reimbursement models as well as loan repayment options. So, right, imagine you're a student, you're in a nurse program, you're about to graduate, but you have $60,000 or $80,000 of debt. This hospital over here says, you know what, why don't you come work for me for 4 years, and over 4 years, I'll pay off your debt. That's what these partners do, but they work with organizations that we work with. And so you create channel partnerships throughout the market. And so this is how I believe we can scale. And from an infrastructure standpoint, from an organization standpoint, we're not recruiting students. We don't have large enrollment teams trying to sell a student, right? We're building the infrastructure such that students are coming to us. We're supporting them along the way. And we built out our systems and technology where we can scale, right? And it's kind of like a science behind, X amount of students, and you need Y amount of team members to support them in, X, Y, and Z capacity. And so, I think we're, well on our way to achieving our goals. I think we built the right team. The team's amazing. I think our technology stack's amazing. And, we're starting to scale, and we're excited to see it.
Yeah. No, I think it's brilliant. And I'm excited about the opportunities that this brings in the higher ed space, because I think that experiential learning is just key, not just to whether or not somebody gets a degree or a certificate or whatever, but also in terms of their preparedness. And this is just a great example. But let's talk a little bit about your broader vision. I mean, you decided to start here in the med side, and you got your hands full. Like, I can't imagine you pivoting off of this anytime soon. But at the same time, you do have a broader vision to get into other industries. Talk a little bit about how you're thinking about that, and when it would, like, what you need to see before you sort of launch that new program that's outside of allied health.
Sure. Well, I can't give away all of our secrets. But yes, we deliberately named the organization Skilltrade. That said, I think there's, traditionally speaking, when you think of skilled trades, more times than not, people do think of your traditional skilled trades. That's construction, manufacturing, HVAC, electrical engineering. But the reality is that the healthcare jobs that we target are actually considered skilled trades as well. And it doesn't necessarily need to be male dominated, right? I mean, even like the concept of apprenticeship training. Historically, you probably think apprenticeship, you probably think, okay, I'm a male and I'm going to go become an electrician, right? Well, guess what? It's not gender specific, right? There's a huge influx of apprenticeship training in healthcare, which tends to be more female dominant. So yes, we did call it Skilltrade for a reason. We expect to expand outside of healthcare. It could be in the traditional skilled trades, as I mentioned, or frankly, it could be in anything that, with training, you can have an occupation or you can start a small business. I mean, what about think about event planning, right? Like for weddings, right? Or any special events, like you can create a training program for that. So we're definitely always constantly thinking about what's next. You know me, Darin, I always like to reinvest in different areas and build, what we call as new capabilities. And, maybe this time next year we'll have a lot more to say about that. And we'll see where we're at in that time frame.
Yeah, no, I think you've got your hands full. There's a lot to happen in the next several years. Love seeing the momentum that you're experiencing already. So higher ed leaders listening to you right now, curious about Skilltrade, what's the best way to initiate a conversation with you?
Just reach out to us. You can go to our website. You can fill out a form. That we have workforce development pages specifically there. Feel free to reach out to me on LinkedIn. And we're definitely excited to talk with you.
Well, Jason, thanks for being willing to do this. I think it's a perfect complement to the series we've been running. And I love highlighting an innovation like this. So congratulations on your success and look forward to more.
Thanks a lot, Darin. Appreciate it.